Good evening to everyone. This is Vance from Kopi with Vance. As usual, before we start our show, here is a cup again, but unfortunately, it's not Kopi. Just on Wednesday, our show, it was water. So today is also water. So weather is very humid, so we all should be drinking enough water, right? All right. Thank you for joining us at Kopi with Vance. And today is going to be a special edition to cover a topic on something we all should know, which is, of course, dementia. And the interesting part of today is Doctor is on board, my guest speaker, Dr. Arvinder, as well as Hwa Chong Institution of Students also will be joining us to have certain discussion that we will be going through. Before I get started on this topic itself, which is, of course, we'll be diving into a lot of Q&As. We're going to talk about what is the way to prevent it, if it's possible, and why is this happening, and is there any preventions that we can also begin to look at. But if you all look at the dementia itself, I think one of the main problem for dementia is as aging, right? But why is this happening? And that is why Dr. Arvinder will be coming in and we'll be explaining a lot more on that. But we all know that dementia is a general term for loss of memory, languages, problem solving, and other thinking abilities that are severe enough to interfere with daily life. And of course, added to that, Alzheimer's is also most common cause of dementia. In fact, we can talk about dementias and Alzheimer's and so on and so forth, but most of the time it's about communication, it's about speech, focus, concentration, reasoning, and judgment. And probably they might even forget they've taken a lunch or breakfast, and if you can tell them, they get offensive. And that's also where we're looking at the early signs of dementia. What is it? Because of memory loss, or the challenges that we talk about, or the difficulties, confusion. So staying tight, because these are the things that we're going to talk today and discuss all these details about. I'm going to bring one of my speakers up, which is, of course, Dr. Arvinder. So let's invite Dr. Arvinder up. Hello, Dr. Arvinder. You got to unmute your mic, sir. Your mic is unmute.
Hi, bro. How are you? Hope everything is okay.
Thank you for joining on a special edition today that we want to talk about dementia. And I have a group of students here who are watching, as well as a few of the students who are joining us today, Isaac, David, and Recess. So all of us will be talking a little bit more on details, but let me pull every one of them up here. Hi, Isaac.
Hi, good evening.
Good evening. Welcome to Kopi with Vance.
Thank you.
Hi, David. Your mic is off.
Hi, Mr. Vanan. Hi, Dr. Arvinder.
Hi.
And Rias. Hello there, Rias.
Hi everyone. Hi Mr. Vanan. Hi Mr. Dr. Arvinder.
Hi, Reyes. How are you?
All right, it's good to see all of us here today, and we all know why we are here today, because we are on a topic of dementia. But of course, Rias, David, and Isaac, they're both from Hwa Chong Institution. But they have been a very interesting students, because, and of course, there are a few more other students as well, but they have been voluntarily doing volunteer work on dementia's patients in homes and all that. So we're going to know a little bit of that. Before we get started, maybe Isaac, maybe you just want to talk a little bit, all right? Each of you all have about less than 1 minute to just talk about what is this all about? What is this project that you are doing? You want to highlight to us so that our viewers will know.
Yeah, sure. So good evening to Mr. Vana and Dr. Arvinder, my fellow panelists, and the members of the audience. I'm Isaac, the leader of Project Curae. So Project Curae is a budding service learning project consisting of 5 students from project institution. We are working with the Alzheimer's Disease Association to destigmatize dementia and to support people with dementia. We hope to improve the mental health of these people with dementia, whilst helping them cope with their battle with dementia, and to reduce the stigma that they face.
Okay, so maybe Reyes, you want to talk a little bit on your project? How is it been going on?
Yeah, sure. So perhaps I'll talk a bit about how our project came about. So actually, Project Curae, maybe a lot of audience will be perhaps curious about what Curae means. So Curae is actually a translation to care in Latin. So actually, we hope that through our project, we can teach our target audience to care and empathize for those who are affected by dementia. So through Project Curae, and some areas of concern that we're focusing on this year. So firstly is to destigmatize having dementia in Singapore, and also to dispel the misinformation and the lack of information that people have, the general public have, towards people with dementia. And lastly, also we are focusing on also reducing the burden of caregivers to dementia patients. So these are like the three big areas that we are focusing on this year.
Okay, thank you. Yes, so we will now jump into David. David, a little bit more on ongoing. I mean, of course, you all call it project, but I know you are more than that because you are spending your time, in this as a voluntary. So you want to share a little bit of this experience because I know as we go on, we have different topics as well about sharing that. But maybe on your part, how is this journey going on for you?
Yeah, so we are currently volunteering with the Alzheimer's Disease Association Singapore. So we will go there about once every fortnight to come and play games with the elderly to stimulate their mind and motor skills so that they will be able to stay active as well and then stay mentally active, which is quite important, I feel. And then we get to interact with the elderly and talk to them, give them company for maybe 1 to 3 hours. Yeah, and it's quite fun.
Thank you. Yes. Sorry, David. Of course, we are going to go into a little bit more into the symptoms and the care, and of course, what stages that we are in. I have a couple of questions for you guys as well. So the later part, we are going to ask a lot of Q&A. And for those viewers who are watching this, you can please share this video so that more people can also get to know what is these amazing students are doing as well. And for Kopi Events and Dr. Arvinder, our main focus here is, of course, to see what are the areas that, in terms of health, in terms of just to keep, to prevent it, the possibility, all right? If you have any symptoms or signs, what are the possibility? We always want to look at possibility, and that is what our great topics have always been. Dr. Arvinder, so next is you, sir. Of course, before we get into the topic, because today is going to be a lot of discussion that we will be going through, but before we even jump into the topic, dementia, is it something scary at this point of time?
I think the only way you can discuss dementia and comment on dementia if you have seen a case of dementia or you have seen a patient with dementia. So until we actually see a patient with dementia or we don't interact with a person with dementia, you may not have any idea what the magnitude of dementia can be. And I think these three lovely gentlemen will know, as they have already, I think, gone under the Curae project, which they were mentioning, and they would have known, or they would know, or they were experiencing what type or what dementia can do to a person. And there are two parts of it. One part is the person who is having dementia, which is actually the least of the problems. It is actually the people that are around them which have to deal with the situation. And I think it brings more hurt to everybody who is around them, because they are seeing their loved one who was once very active, very usual, very I would say in simple terms, brainy, very intellectual, suddenly have a bit of a deficiency in their brain or cognitive function in that matter, or in simpler terms, their brain activity has actually reduced in the sense that they can't remember things, they can't recall things. There are a couple of things which will, I think, that is the one which is the biggest issue. The caregivers and also the patients themselves. I think not mainly the patients, because they may or may not know what's going on, but I think the biggest issue is the caregivers who are giving them the care. So I think these three gentlemen who have gone, even though it's a very short period of time, 3 or 4 hours, but I think it's adequate to actually know what dementia is all about.
Thank you, Doctor. Thank you for that. We are going to jump into the questions that we have for panel discussion today. But before that, I think it's also going to be a very tremendous load for the loved ones. Imagine if, as a mother or wife or husband, whatever relationship can be, and then the moment you go in there, they forget about you, who you are, and then they tend to forget about you. And I have seen a few cases before. It can be very quite saddening, because the stage actually deteriorate to a point where the particular person cannot even breathe. I mean, cannot even eat and drink voluntarily. They can be in a stage of can't even relax. The whole body can be stiff. There are so many various stages that we are talking about here. But the first thing that we're going to talk about is, of course, I'm going to ask maybe Rias, ask us any question that is relating to dementia. Then we will take it on from there and we get the ball rolling.
Okay, yeah. So perhaps I'll start off with perhaps one of the most common misconceptions that people have about dementia. It's also related to the symptoms that of dementia. So, Dr. Arvinder, is dementia actually a normal part of aging? Does everyone get dementia at some point in their lives?
Oh, that's a good question. I think for us to understand dementia, you first have to know what is dementia all about, because it can be a impairment of your intellect, it can be an impairment of memory, and also impairment of personality. And most of the time, it's global. That means it is everything encompassed together, especially on your day-to-day activity. So to actually say that it is aging, there are a couple of types of dementia. One of them is vascular dementia, which is the actual aging process, because the blood flow less into that particular areas of the brain. So you must just remember that the brain is actually like a big memory card, or a memory, your computer hard disk with a lot of wires. So as you age, these wires actually become either slower or they disconnect. That means there's no flow. So information goes in and out, and that is where you know how when you have a computer hard disk, you want to keep stuff, memories inside, and you also want to retrieve. And that is what happens in dementia. Of course, there are other etiologies which maybe I will talk to you a little later about. But one of the thing is, aging is often confused with normal dementia. But as we progress along, we actually feel that with aging, it's vascular dementia. And later when we talk about how to avoid or prevent dementia, some of the already notable ways, you will actually realize that, oh, that is why it is happening, because we find that the brain activity becomes better. So you would have seen, let me just give you a very, very brief example. I will give you two different examples, all right? One from Malaysia and one from Singapore. Look at the late Mr. Lee Kuan Yew. He was very, 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 very sharp until the very last day. He mentally prepared, mentally sharp. He can rebut his knowledge. He can still remember everything which has gone on, which was fantastic. But again, as you guys would have probably seen, a person who is maybe slightly younger than him, than what he was, maybe 70s, but already with dementia. So why is that? Why is there a discrepancy? So it is probably due to the activity. So I always say, just to give a very brief statement, it is always the activity which you keep your brain at. You know how they say that an empty brain is a devil's workshop? Because you keep thinking about things. So what you actually have to do is you have to start thinking about productive things. So there are a lot of other ways which I'll probably discuss a little later. And the other second person I want to bring to your attention is the former Prime Minister of Malaysia, Tun Dr. Mahathir Mohamad. He is also 95 now, 94, 95, going 95, 96. He's also very active. He's very sharp. You see the way he speaks. He can still give very witty statements like the late Mr. Lee Kuan Yew. It's because of the brain activity which is kept. So I don't think to say that aging per se is actually a cause of dementia. I think it is brain activity and brain usage. And by that, I don't mean whether I'm talking about intelligence. I'm not talking about intelligence. I'm just talking about normal brain activity. So to rather actually pinpoint and say that it is age related, not very accurate. Can be accurate up to a certain point, but not absolutely accurate.
Thank you, Doctor. Thank you, Dr. Arvinder, for that. Well said. And thank you for the questions as well. Maybe I will pose this question to David. Right? David, in your experience when you were as a volunteering, right? When you're volunteering, what are the signs and symptoms you saw? What kind of experiences you want to share there a little bit?
I think one of the most obvious ones is like when you talk to them, you see that they repeat the same talking points over and over. So yesterday when we went to visit them at the association, there was this man who kept on talking about the same exact thing about our ex-principal, and he would say that thing like he would repeat the same talking point for about an hour. So that's one of the most obvious things. And another thing that's it's a bit sad because there's this early onset dementia patient. He's about maybe mid 40s, late 40s, and he comes in with his wife, And the saddest part is that he doesn't recognize who his wife is and just calls her as auntie. So I hadn't had the time to personally talk to her or him yet. And I mean, it's just a bit sad to see lah, because he doesn't recognize the wife, and the wife, but it's quite heartening to see the wife still cares a lot for him and brings the husband out, even though he doesn't even know he doesn't even know her name, and it makes me feel quite sad lah. Yeah.
Okay, but as a panel we are discussing, right? I mean, can you imagine if one of our loved one come and say, "Who are you?" Right?
Yeah.
I mean, for the person as a caregiver, I think they go through a biggest challenge in taking care of them. But of course, at the end of the day, they just said, okay, I want to give my best care and love to that particular patient, right? But doctor, coming back to you again, so we often hear, retire at certain age, chill back with your, maybe a Coke light, or even you talk about some beach drink, lying on the beach and, spending your time, the rest of your lives, relaxing. Do you think it's a good idea? Or keep the mind active by getting involved in a lot of projects, go and take up a hobby, go for a walking, some kind of a routine. I think, is it because of those things have been left off? That is why the mind becomes like an empty, I'm not saying empty vessel, but eventually it becomes to a point where the sicknesses kicks in. Is that one of the reasons?
Vince, what I will do is I would like to explain this with the analogy. You're a fitness instructor. If you don't actually work out, you see your clients who don't work out, what happens to their muscle bulk? It actually drops, right? Because the muscle is underutilized. I would think, or I would say, in not metaphorical senses, but just a very just a comparison, that I feel that the muscle is also the brain is also like a muscle. Okay, it doesn't have the same cells, doesn't have the same functions. However, I think it functions the same in the way that the more you utilize it, the better it becomes. Do you realize that if you are actually surrounding yourself with a lot of intellectual people who have very fast responses, very witty and fast responses, you find that you also train to become that way. The reason is you are training yourself. So what actually happens is, I think as people, as you mentioned, that as people age, they look forward to retirement. But what they actually don't talk about is, when about 2 or 3 years, when you go and speak to a retiree and ask them, hey, how do you feel? Oh my God, I feel like my brain has rusted. That is the common term they always say. My brain has rusted. Why? Because the mental activity has actually dropped. When you go to work daily, you know that you have to pick this up. Okay, you have a plan. I'm going to do this, I'm going to do that, I'm going to say this, I'm going to say that, I'm going to sort this out, I'm going to sort that out, and you're done for the rest of the day. So I asked a lot of people, and in fact I have a lot of doctor friends, maybe some of them who I call uncle and auntie, but for good reason, because they are much older than me. But when I ask them, they always tell me that, what, I'm done, I'm going to retire. And these are people who are 60s, 70s, and I'm honestly telling you, I have not got anything less than 80% of them who have regretted their decision. A lot of them end up going and trying to work again in another form. So a lot of people, after they retire, they decide to get involve a lot of themselves with social work. Why? Because it gives them a project and activity. So the brain still functions. You still have to read, you still have to talk to people, you interact with people. The entire motive may be very different. When you are younger, you're probably wanting to work and earn, which is a different motive. Now you are not only helping people, but you're also helping yourself. So I think it is a motive that as you age, that you want to look forward to relaxing. But I think it's relaxing physically, maybe not so much mentally.
Thank you, doctor. So next question, I'm going to pose it to Isaac. So Isaac, what is the state of dementia in Singapore versus the rest of the world? Do you have any stats to share with us?
So according to the 2015 World Alzheimer's Report, the number of new cases of dementia each year is 9.9 million, which means it's one case every 3 seconds. So in 2018, there's estimated 50 million people worldwide living with dementia, and in Singapore, in 2018, the stat was 82,000 people with dementia, and by like 2050, it's estimated to reach 200,000, about 240,000 people with dementia. So that is quite a lot of people, don't you think? And so the people with dementia will nearly double every 20 years. So in 2030, it's estimated to reach 80 million worldwide, and in 2050, it's estimated to reach 152 million worldwide. So much of the increase will be in developing countries like Singapore. Yeah. So those are the stats that we have. So
Thank you.
yeah.
Thank you for the stats, Isaac. So now we'll go to Rias, right? Rias,
Sorry,
I know
Vince,
you
can I
guys-
just say something before
please
that?
go ahead. Please go ahead.
Oh, sorry. One of the things, Isaac, I think why that it has happened is because in the past you actually would have seen someone who is forgetful, or people who didn't go out much. They don't lose their way, and these days you get WhatsApp messages or social media messages saying that people saying, oh, this so and so person looks like that. They have a picture there who has gone out wandering and accidentally got lost. They have very poor memory. Please bring them back. Now that prompts an investigation. In the past, we didn't have social media where this didn't happen, or people rarely went out. They were actually more confined to the homes, and I think diagnosis was very difficult then, because in order for a diagnosis to happen, you have to go and see a medical professional for that to happen. I think diagnostics, criterias, more insight on what dementia is all about. That is why we are seeing more and more, and I can honestly say, like all the other diseases where something becomes clearer, it becomes more understandable, you will find that there are more and more people. I'm in fact very surprised to hear that a 40-year-old man has actually dementia, which David was sharing just now. But again, am I all of that surprised? No, because I think we are going to come to a point where we're going to see even younger patients having dementia due to other different reasons, which I will share with you all later on the different types of dementia. But yeah, there's something I just wanted to add on, Isaac. Thank
you, doctor. Thank you for adding on to that. So we'll go back to Rias. So Rias, I know you have been very actively involved in this volunteering. Do you have any stats for how costly is dementia in Singapore especially?
Yeah, so all right, when we look at cost of dementia, we're actually looking at a spectrum of like different kinds of costs. So mainly when we look at cost of dementia, we look at two different kinds of costs. We can categorize them into informal caregiving costs as well as formal caregiving costs. So as of 2015, according to this study by the Monetary Cost of Family Caregiving for people with dementia in Singapore, the cost of dementia is actually about 2.8 billion, like totaling up both informal and formal caregiving costs. So when you think about it, it's obviously very costly. But when we break down the cost and we look at both categories, we see that informal caregiving costs actually accounts for about 3/4 or about 64% of this 2.5 billion in cost in Singapore alone. So for many of the viewers who may not actually be very familiar with what informal or formal caregiving is actually, informal caregiving actually encompasses when, like, let's say for an example, when someone gets dementia, their family members may not be able to continue working, or they may need to stay at home time in order to give care to their family member with dementia. And because of this actually causes like a great burden in terms of like their financial in terms of the financial aspect. So their income is greatly affected, and this is what the informal caregiving takes into account. Whereas formal caregiving is actually more on the healthcare that is given, like hospital bills and let's say like organizations, like the amount of money put into organizations to actually accommodate these people with dementia. So that is what formal caregiving costs actually takes into account for. So it's actually quite shocking to find that you expect that formal caregiving would be more expensive, because healthcare is obviously a something that is quite expensive in Singapore. But actually, what the biggest brunt of the cost is actually comes from family members who are losing their incomes because of their loved ones with dementia. Yeah.
So in short, we can understand that when someone goes under dementia, I mean, the family members definitely have to take care, right? And of course, they have to do a lot of adjustments. It's not sacrifice, but it's a lot of adjustment for their loved ones. So even they can have to, quit from their job, or maybe they have to add additional help to the family by, getting helpers, and so on and so forth. So we can understand that the financial burden will definitely go up as well. We will come back there again on the topic of cost. But now we have a viewer, Dr. Arvinder, so I'm going to divert that to you. That viewer has actually asked us, what is the difference between dementia and Alzheimer's? So that is for Dr. Arvinder.
Okay, so you're asking me what is the difference between a car and a tire. The tire is part of the car. So Alzheimer's is part of dementia. You have a whole different type. You have Lewy body dementia, you have Alzheimer's, you have all the other, this one which is all under dementia. So dementia is like an umbrella, and then you have all the other sub things below. So I would like to say that basically what are the few causes or types of Alzheimer's types of dementia is basically parenchymal disease. That means any disorder to the brain. I don't know how often you hear when you person does a CT scan, they will say mild degeneration of the brain, because as they age, the vascularity within the brain decreases, and that is why the I would say the tissues around the brain or of the brain actually reduces in number. So parenchymal disease, vascular disease, which is related some portion to aging. It can also be related to other causes like cardiovascular diseases, metabolic diseases like cholesterol, high cholesterol. You also have toxic dementia. When people consume alcohol, they consume drugs, they consume or they accidentally inhale or ingest some certain chemicals, they can also get toxic dementia. Metabolic dementia, there are people with diabetes, and this is very important because we see a rise of diabetes in the country, in Malaysia, I think in Singapore, in the world, we are seeing a rise in diabetes, and that in very, very long periods of time can actually lead to dementia. It is linked to dementia and depression. So that is also something which is leading, and I feel you guys, maybe when you go the next time, if you are just asking or you happen to know, just see how many of them are actually diabetics. You will be very, very shocked. There's also a disease called Wilson disease where there is copper ingestion. It is because of eating. Basically, when you eat and you ingest too much of copper, that can also cause dementia. Endocrine disorders, hypothyroidism, those people who are depressed, and every time when a person goes to the psychiatrist, most of the time they'll actually check your thyroid function to make sure that it is all normal, because endocrine dementia can also happen. You have infection based, that means if there is a Creutzfeldt-Jacobs disease. Remember many years ago where they had a prion disease called mad cow disease? That can also cause dementia in the long periods of time. And these sort of things. Of course, you have traumatic dementia. That means because of some brain trauma where there was a blood clot, which may also be linked to infection. And of course, neoplastic meaning any type of lesions in the brain. It can be cancer or non-cancer, which can also cause. So these are the type of few things that actually causes dementia. And to answer the viewer's question, Alzheimer's is actually a part of dementia. So whenever you see a person who is very forgetful and you say they are having Alzheimer's, is actually not the right thing. It's actually they're having dementia. It may be Alzheimer's or Alzheimer's.
Thank you, Dr. Arvinder, for that. I'm going to go into a little bit more understanding of the early symptoms and signs. So thank you to the viewer, Anu. Thank you so much for the particular question. So doctor, the next question I have for you is, how do doctors diagnose a patient with dementia? I mean, it can be early stages, we all forget things, right? We're supposed to have an appointment, let's say around 3 o'clock, and sometimes we forget that. So how should we worry, that, hey, how come I'm becoming forgetful? Is it because too much of things in our database and we can't process it? Sometimes it's in human nature to forget. But if it happens to someone who's in the 60s and 70s, if they wear one socks and then the other leg doesn't have a socks, or probably, they want to go out and have lunch instead of dinner. So, is there any signs and symptoms that anyone can look up for?
Just to share with you, I know some people who forget to wear their socks even though they are in 20s. Some people call it style, some people just naturally forget. So it comes to the question, Vance, actually you brought up a very good point. You forget to lock your car, or you keep forgetting every time, hey, did I lock my car? And then you go back and check. So basically it comes to the point that, do you have dementia, which is something even the is not easy for doctors to say, because there are a couple of things you need to do. You have to get a history taking, and the thing is, most of the time when you take a history taking, you can't actually ask the patient, because the patient may not remember anything. So you must ask the caregivers, and most of the time the person who brings may not be the caregiver who is looking after that person all the time. So that itself is a big stumbling block. Of course, they have a criteria where they have to actually look and see whether there's disorientation of time, place, person. You can't remember what time of day it is, where are you, but even a very fair Vance, if it's a very long weekend, 2-3 days holiday, and then I ask you, hey Vance, today is what day is today? And then you will be like, oh, I forgot. Does that mean that you have dementia? No, it doesn't mean. So it is a disorientation of time, place, and person, and there's a decline in cognitive function. That means in the way you think, in the way you behave, or a person, the way you behave, and then memory impairment. You cannot remember information which I just, like for example, one of the tests is when we do dementia, we always ask the patient, okay, I'm going to give you a number called 321. A simple number, 321. I'm going to ask you in another 10 minutes. So you keep on asking them questions, and then you suddenly ask them, hey, remember that number which I told you? Then some people are like, no, I don't remember. But again, how many times has someone told you a very simple thing, a very simple number, a very simple instruction, but within that space of time you actually forget? Okay, impaired thinking. That means if I say, okay, I have a pair of scissors, I have a sheet of paper, what do you think, what activity can you do? So a person may say, I will use the scissors and cut the paper into a material of that sort. Okay, so there are some people who can think that way, but they can't do it. Some people will say, I will take the scissors and wrap the paper around it. So that is impaired thinking, or I'm just giving a very brief example. But the most important thing, Vance, like I was telling you, whether you locked your car, whether you remember certain things and all that, it must be at least for 6 months. So Vance, if every day or every 2-3 weeks I ask you, Vance, what day is it? You don't know for 6 continuous months. There's something to be very concerned of. But I doubt I will get anything of that sort or that nature. So it is not a lot of caregivers walk into the doctor's consultation hoping that they will get a diagnosis there and then. So most of the time we say that it is, or it may be dementia, but what type of dementia we will have to investigate further. And normally you need specialized care of psychiatrists. Unfortunately, a lot of people, the moment they hear psychiatrist, they say, oh, this fellow is mentally off. It's not that. It's because psychiatry actually deals with brain dysfunction or cognitive dysfunction. So even in depression, that person is actually normal. That person has nothing wrong, but it is dealt by the psychiatrist. So that is why it is classified under a mental disorder, because of the psychiatrist's involvement.
Thank you, doctor. Thank you. So we have more questions that's coming up. So the next couple of questions, we're just going to go in a very quick 30 seconds or 40 seconds of answer, because we have lots of questions that's coming up. So now I'm going to pose a question to David. Okay, sorry, I will pass it to David. So David, can you introduce your beneficiary of Alzheimer's Disease Association, ADA, and what can they do, or what you can do, or what we can do?
Sorry, Mr. Vanan, you're lagging. Could you please?
I said, could you introduce your beneficiary, Alzheimer's Disease Association, ADA?
Oh, okay. So the Alzheimer's Disease Association is a social service agency that's made out of 3 types of people: caregivers and professionals, as well as just people who are interested in dementia, like our project Curae. And so it provides a daycare service for people with dementia, as well as services such as like counseling, support groups, referrals, and public education talks. So they also conduct training and workshops for caregivers, and then they also have things like Memories Cafe and places for things where they bring the people with dementia out. So I think a few years back, they brought the people with dementia and their caregivers to Taiwan for a little trip to the Taiwan Center of Alzheimer's Disease Association from Taiwan. And it was an exchange program of sorts. It was quite interesting. Yeah.
Okay. So I know, you have been doing this volunteering, and what are the things that you are must be in concern? I mean, always in mind that whenever you deal with, either you can be kind or you have to be volunteering. What is the things that you all always do? What is the special thing?
I think honestly it's quite simple. Like when we interact with them, we just need to make sure that we don't make assumptions about them or have like preconceived notions that they can't speak properly because they have bad memory or because they have Alzheimer's, and because, or even because of the fact that they don't remember what the conversation is, doesn't mean we should exclude them from the conversation. And we need to make sure that we should talk to them nicely and be patient with them, even if they don't understand what we're talking about or forget it. Yeah.
Okay, thank you, David, for that. So, Doctor, we will come back to the questions again, but we try to get these questions out in less than 40 seconds so that we have more time for the audience. So, the first one will be, are there any new methods of treating dementia, Doctor? We have 30 seconds. Or possibly.
Very good question, but it depends on what type of dementia. I think we have to know what type of dementia, then we know whether there are any new type of treatment. Most of the time is actually they want to slow down the progress of the disease. There is no cure for it. There are preventive measures though, which I can talk about a little later on. There are some types of supplements like tocopherols which have shown some amount of benefits, but otherwise I would always recommend that you see a doctor. Make sure that you follow the treatment which is given by the doctor. That is the utmost of importance.
Thank you, Doctor. Thank you for that reply as well. The next one also I'm going to go to you because another viewer has also asked, is there any medication that actually can help dementia?
So like I said, again, it depends on what type of dementia like they have. Like I told you, there are so many different types of dementia, because sometimes if the dementia is actually caused by a growth in the brain, the answer may be to actually have chemotherapy or even removal of that growth in the brain. So there may be some psychotherapy or cognitive therapy which is given to the patients, which may not involve any medication at all. If there's any infection of the brain, maybe they may give some amount of antibiotics, intravenous antibiotics. Sometimes there are some certain supplements. There are a lot of theories which are going around, especially coconut oil, tocopherols, which is a vitamin E. It's a palm oil extract, which is Asia is full of, which actually has helped with a lot of patients, especially those patients traumatic, like when they actually get a stroke and all that, and they get dementia. They can actually, there is some amount of recovery, but of course we need more data before we can actually affirm it. Yeah.
Thank you, Doctor. So the next question I'm going to pose it to Rias. So Rias, I know you have been doing quite some time. How long have you all been volunteering?
So we started. All right, for Project Curae itself, it's actually a second year project. So it's been started by our seniors. So actually, this project has been running for 2 years. But as for us, this group of us, Isaac, me, and David, we've been volunteering at the ADA Center for about 4 to 5 months now, since the end of last year. Yeah.
So you've been there for almost about 8 months?
4 to 5 months. Yeah.
So 4 to 5 months. So during these 4 to 5 months, what are some of the common signs to look out for in dementia patients? I mean, you might have been interact with people over there, but what are the common signs that you think that they look out for in dementia patients?
Yeah, so okay, I'll introduce this actually kind of framework that we were introduced to in ADA. It was the 10 warning signs. They gave us a very useful abbreviation. So it's actually ABCD. So firstly, like some warning in terms of A is the activities. So the warning sign is having difficulty in performing some familiar tasks, such as like perhaps always being able to like go down to the market and buy food for yourself, but suddenly being unable to trace your steps back home. So, and then as for B, it is behavioral changes. So as for behavioral changes, it will be more of the loss of interest in hobbies or personal activities, or let's say changes in mood or behavior. This is also things that could be warning signs that someone has dementia. And for C is cognitive decline, which is having challenges in planning or solving problems, or perhaps having memory loss that disrupts daily life, and problem with language and self-expression. These are some examples. And lastly, D is disorientation, which is the confusion with time or place, which is mostly like the first example that I gave with being unable to retrace steps or like losing a sense of direction. So these are like some of the most common warning signs, because it's quite important to understand that it's not just about being forgetful, which is what is commonly associated with dementia. It's also about that also oftentimes comes with behavioral changes and a lot of other array of symptoms as well. Yeah.
Thank you, Riaz, for that beautiful reply. So, Doctor, we're going back to you again. We have another viewer asked us another question. Very quick one, because so that we can move on to the next gears, and then probably you can ask more Q&A. Doctor, is this for you? Out of all these people who get dementia, earlier I guess, because you put it yearly, how many are cured?
So, like I mentioned just now, I think you can't say cure. It is slowing down. It is a progressive type of disease, and you actually can't cure it. Of course, you have to see the types. If it is due to neoplasm, some psychotherapy, cognitive therapy may help. But I think it is you can't expect the patient to be as what they were, but you can slow the disease down, of course, with certain things. So I've always told my patients that to increase their brain activity, one of the simplest brain activities you can actually help a patient with, I don't know whether you guys want to try it with your guys who you go there and see, is simple Sudoku. You get them to do the very, very, very simple Sudoku. Of course, if they're very advanced, having very advanced dementia, they may not actually be able to. But that guy, like you were saying, that 40-year-old guy, there may be some chance of mild reversal. I won't say cure, but reversal. You can just ask them to do Sudoku. And of course, you have to give them the very simple Sudoku. I always tell people, if you want to start learning how to play football, you don't go and play with a professional footballer from the EPL straight away. You have to start at school level, and you play, of course, or you have to play with your peers. So always start them at a very low level, and if they say, hey, you know what, this is simple, and I've got a lot of patients who come and say, hey, this is simple, so you give them the next notch. I won't say it's a cure, but of course it improves their cognitive function as well. And I would just like to add something to what Reyes mentioned just now. Basically, why is the cost increasing? Because of exactly how he puts it. There's a person who always goes to the market, they don't know, they lose their way to come back. So what do? They get GPS signals. You see, they get bracelets who say that, I am a patient with dementia. In case I'm lost, please send me back to 1 2 3 4 5 6 place, or contact this telephone number. So I think with these type of things, which we won't have, and normally it was a medical bracelet, now it is becoming more tagged, so you don't have to disturb people. You straight away can get it on your phone and all. So I think with this type of modern technologies, that is how the cost is actually going up. And of course, with specialized care, anybody can give care, but specialized care and effective care, that is where the money is actually going. And of course, newer medical modalities.
Thank you, Doctor. Thank you for that beautiful reply as well. So we have Junior here. I think he has went a little bit more than to the another part of the caregiver. See, it's important to realize that when we talk about dementia, it's not just about the patient that is affected. Many times, his or her family members are the ones are most affected mentally and physically. It's really difficult for the caregiver to see his or her family member change so much, especially heartbreaking when the dementia patient is no longer able to recognize their loved ones. So I'm going to go back to Isaac. So Isaac, during your volunteering, do you manage to meet the parents or the loved ones who are coming to visit there? How was their mental state, or how do you see? Were they like showing off, or they're like very strong and they said, I want to give the best, or you spoke to them? What was the condition at the point of time?
Yeah, so for us, when we have our sessions with the people with dementia, usually their caretakers will be with them. So for me personally, when I have talked to the caretakers, all of them seem to be like quite used to what's happening with their loved ones already. So I think they already are used to it. But of course, if let's say their father or their husband or their wife can't recognize them anymore, I think it's definitely going to be quite sad for them. And I don't think it's something that you'll ever be able to get used to. Like someone that you're so close to for like years or even decades of your life, then I just suddenly just doesn't recognize you. So I think even though they may be able to just like get used to it, but I don't think they'll ever like stop being like upset about it or being sad about it, because that's just something that I feel can't really be reversed. Yeah.
Thank you, Isaac. So I'm now going back to David. So David, what is the most common misconceptions people about dementia and in the society? So you're going to answer two parts. What is the misconception about people about dementia and in the society?
I feel like a lot of people, because this comes from a way of personal experience, because my grandparents have dementia. Both my paternal grandparents have dementia. So me and my family has also been trying to navigate dealing with dementia patients. And I think one big misconception that my family had was that at one point we thought that because my grandfather couldn't answer our questions, he couldn't understand, he couldn't reply back, or he wouldn't even remember what we said or what he had for breakfast, whether who our names were or whatever. We just thought he was stupid. And honestly, that was quite mean in hindsight. But at like when we first encountered it, it was quite shocking now, because we didn't really know how to deal with someone with dementia, and we didn't really experience it firsthand that someone maybe would be like that. And then we just thought he was like stupid or dumb. And I think a lot of other people have this misconception, and I think we need to realize that it's not their fault, and we need to be compassionate and understand where they're coming from.
Thank you, David. So I do hear you, and you also mentioned that people tend to give judgment quickly.
Yeah.
Right. When someone is bringing along, especially I can imagine, right? It's like a 40 years old or even 50 years old, whatever the age right now. Even doctor mentioned it's a 40 years old, so it's quite scary in terms of age-wise, right? In the past, I'm talking about the past, in the cardiovascular diseases, right? It only happens to people who are above 50 and 60s and 70s. We're talking about myocardial infarction, which is well known as heart attack. But right now, the statistic shows that even the younger age, the age is just going lower and lower and lower. So that's a bit scary. So in your reply, I do feel that people tend to give judgment quickly, rashly, and then then the loved ones who are beside them, they will feel it even more. Am I right to say that, David?
Sorry, my connection was a bit bad.
So do you think that society is not ready to accept it?
I wouldn't say it's not ready in the sense that they do not have it in them to be compassionate and empathize, but I think they're just ignorant as to the effects of dementia.
Yes.
And I think through better education and awareness, we could help people understand where they're coming from and how it feels like to live with dementia, which is what our group is trying to do. We're trying to advocate for dementia help and increase awareness in the general society, so that we can have a more accepting society, and try to reserve judgment and not be so judgmental in overall.
All right, thank you,
I
David.
think, Vance, just to add to what David has mentioned, I think people from the Chung Hwa Institute who have come the Curae group is absolutely vital, because you need younger people who come and to advocate this, especially among their age groups. Why? Is because these younger people are probably among these many young people, they are actually probably in the future going to be caregivers for someone who has dementia. Okay, and that is absolutely vital. I think it is not that people are uneducated or they get they are judgmental. I think the problem is they don't understand it. Many years ago, when we talked about diabetes, nobody understood diabetes, but now everybody understands or better understand what diabetes is all about. And I think another thing which Reyes also David mentioned was actually the caregivers are actually okay with it, but the problem is some of them may actually mask it. And it is not actually the caregivers that are only the ones who are having problem, is because of the outside factors, people coming and say, hey, why the person doing like that, are you then they become judgmental of that. The person who's suffering dementia may not realize it, but the people who are looking after them, they are the ones who are going to feel it, because they are actually the barriers between the dementia patient and the rest of the world.
All right, doctor, thank you. So we have lots of questions that has poured down. So just a very quick one, all right? It's going to be a speed round. You just have to answer. I mean, possible. I know we do talks that last over 1 hour, but unfortunately, all the questions are coming in. So we're going to do a quick one, as fast as possible within 30 seconds, all right? So, Dr. Arvinder, for you, it's not a disease, it's just a memory, a breakdown. I have someone who asked me here, can dementia be linked to hereditary issue? I mean, you heredit from your parents?
So things like diseases like Alzheimer's have some amount of genetic predisposition. Some certain sort of brain cancers, neoplastic lesions can be hereditary, but I think most of the things like metabolic, like Wilson's disease, where there's too much of copper, is basically based on behavior. Some infection, like basically due down to either things like rabies or Japanese encephalitis, are some sort of that, or even Creutzfeldt-Jacobs disease, which is the mad cow's disease, could be because of human behavior, not cooking meat well, or eating unclean meat. Toxicity may be due to carelessness. So I don't think it is only down linked to genetic, but there is some part where genetic plays a role.
Thank you, doctor. Thank you. As we speak, we have a big series of questions just falling down. So I'm not sure how we're going to take this, because it's just constantly coming in. But we have Anu here, but I'm going to divert it to the Hwa Chong Institution students. So I'm going to put it to Reyes. Reyes, we have Anu here who said that are people more skeptical to dementia if they lack the support of a family first? Answer that part, then the next one I'll ask Isaac. Reyes, your mic, you need to unmute your mic.
Oh yeah, sorry about that. So yeah, of course, answering Mrs. Anu's question, people are of course more susceptible to dementia if they lack the support of a family, because one of the actually the main ways that people get dementia, or one of the factors rather, is the lack of social interaction, and that can also be quite a big role, can play quite a big role in the chances of a person getting dementia. Yeah.
Okay.
Yeah,
thank
so
you.
so definitely, I think it's definitely a high chance for someone who is of older age living in an old age home. It's probably it's probably more likely that he will develop dementia more than someone in a loving home, because as Reyes mentioned just now, a lack of interaction is indeed one factor of dementia, and one way to reduce the risk of dementia is to have like a lot of social interaction. So I think that definitely someone in a loving home would be less likely to develop than someone in a old age home. Yeah.
A lot of the whatever the guys mentioned is actually very true, but I would just like to correct one fact. It is not because of being in an old age home that is actually causing the dementia. Part of the problem with dementia, it can coexist or can be mimicked with depression. So I think being in an old age home when they are depressed can also mimic some amount of dementia. But of course, with medical tests or medical questionnaires, you can actually try and differentiate the two, although sometimes it's very difficult. But I think depression and even some comorbidities like diabetes can also cause that.
So it seems like it's a correlative, doctor, right? If you have blood pressure, the chances of myocardial infarction, if you have diabetes, and if you have blood pressure, and if other illnesses. So it seems like it's all relative, all waiting to come and visit you, but they don't intend to go back. They intend to stay with you. It looks like that, right?
Correct. So that is why nowadays we say when you stay healthy is mentally and physically. It is no more only physically alone or no more mentally alone. It can't coexist in silos. They have to maintain as a group, and that is what it's all about, basically, to keep healthy mentally and physically.
Thank you, doctor. So I'm going to take another few more questions before I go back to the boys. So this one again, a very quick reply as much as possible. Does dementia affect the person's health?
Definitely. When a person is having dementia, the people around them may not want them to actually exercise regularly, especially if they're taking walks around their local places, because they are actually worried that they get lost. I think it may affect their mental health, because they may coexist, like I said, it may coexist with some amount of depression. But at the same time, I think in general, yes, it can affect a person's health, because especially when they don't exercise even more, their diabetes, their hypertension, all the other factors may actually go out of control, because exercise actually helps that. So that is how it actually affects. So I think it is a co-linearity. It's two things together. This affects that and this affects this. So yeah.
Thank you, Doc. So we got one more question that's pretty lengthy, but I think we'll take this before we go back to the boys, and then we have about another 10 more minutes for the audience to ask us any more questions. I think the questions are already flowing around, so it's a bad idea to ask for more questions, but it's okay, right? With the boys are here, doctor is on board, so we can try to take as much as possible. So, doctor, this is going to be a bit lengthy, and let's see what we can understand from here. That's a very good question. I care for my grandfather who has dementia. It's been 4 years. First thing I noticed was him becoming very tasty. I started to withdraw from social interaction. He also started calling me a liar because he could not remember things. I was getting puzzled as to why he could not remember things. Then he started to dawn on me, got him diagnosed, and started on medication. Now, 4 years later, he can't remember anything from even a minute ago. So, doctor, so this is the thing, right? I speak to you, you speak to me. I remember the stuff you told me, then you remember the stuff I told you. But the next minute I forget. So as a person who living or caregivers or even the loved ones, I mean, we talked about this earlier, but it seems like it's popping up again and again. How will be the mental state of the caregiver? Can they go into anxiety, or can they go into depression as well?
They can go into depression. They can go into in a couple of ways. Depression, because they see their loved one who is actually having this ailment. The words that the patient may hurl at these caregivers, which may not be intentional, because they think that they can't genuinely remember what's happening. So I think education is actually very important here. And one more thing is anxiety, because when a person actually sees their family or caregiver, the family actually undergoing this with some amount of genetically linked issues, they may wonder, will that happen to me in future? And I think is also another depression and anxiety thing is when I think especially parents who are going to look after people with dementia, their kids are observing them, and if they actually treat them harshly in future, that also is there, and it may bite them back. And that is where I think the burden of I won't call it a burden, but the weight of the world falls on the caregivers, and it is not an easy task. But I would like to commend that person who asked the question, for not giving up on his grandfather or her grandfather. Mr. or Miss Pen. Yeah, I hope that you stay strong. Most important thing is the caregivers need supportive help. They need another family member to once in a while relieve them of their duties. They need to go and see someone for also their mental health assessment to make sure that they are okay. That is important.
Thank you, Doctor. I mean, I'm also going to share a little bit of status. I do know a loved one. It's going through a dementia, but it's very emotionally drained, mentally disturbed, because it's a lot of changes that's happening in them. One moment you see them before, a couple of years back, they were like very happy and joyous, and then as time goes by, the deterioration is getting worse and worse. It's all our prayers and blessing. Hopefully, they can find a cure for dementia. I mean, there's a lot of illnesses at this point of time that is related to the human. There's no cure has been found yet, right? One of them like cancers, and I mean, of course, they're trying very hard. Do you think there will be ever in the medical science that can do a breakthrough?
I think there will be. I think we were actually quite close when it came to some amount of myelination of the sheets. They have actually brought it down to myelination of the sheets, and that is why the brain it shrinks because of the mass of the brain. I think they have also found some substances which may be found in coconut oil, tocopherols. I think they're quite close, and there are a lot of institutions, especially the Alzheimer's of UK. There are a lot of Alzheimer's of US. There are many societies. They're heavily funded. I think there's a lot of work going on. Of course, it is not an easy thing, because remember, whenever you do clinical trials among these particular vulnerable group of patients, it's not all easy as ethical. So I think it is a long haul, but I think eventually we will find something that works generally for many people. But again, it depends which point of Alzheimer's or dementia which the person is on.
Thank you, Doctor. So now I'm going back to Reyes. So Reyes, you have been volunteering, and what are you guys' future plan? What are you planning to do in the next 6 months or 7 months of the time?
Yes. So for now we are keeping up with like our bi-weekly sessions with ADA. So basically we're going down to the center to have activities with the elderly, and like these activities such as Sudoku or like calligraphy, as well as like just some activities to stimulate the mind in these centers. And other than this, we also have some other social awareness programs such as like this talk, and we also have a few more coming up in the months to go. Yeah, so that's our plan.
All right, Isaac, your plan?
What? Sorry, could you repeat that?
I say your plans in the next 6 to 7 months of this volunteering. What do you plan to achieve?
Yeah, so I guess through the events that Reyes mentioned just now, like we hope that we can improve the mental health of these people with dementia, as well as to help them cope with better with dementia, and also in Singapore also to reduce the stigma that they face. Yeah. So yeah, those are our main aims. I guess.
All right, thank you, David and Reyes. So now we're going to thanks for Reyes and Isaac. So now we're going to David. So David, at this, so you guys are what now? 15 or 16?
Yeah, we are 15 this. I'm 15 now, but the rest of us, I think, yeah, we'll be 16 this year when Sec 4, so our last year in high school.
At this young age, you guys are doing a fantastic and a brilliant job by not only studying, but also doing a lot of volunteering job.
Thank you.
Alzheimer's. But what I'm actually a bit keen at this point of time to ask you, David, or maybe you can answer. You all have any a particular interest to become doctors in the future?
For me, not really. I'm more interested towards like music and the arts. So that's more of my inclination, and I'm thinking of pursuing that in the future. Yeah.
And how about Reyes?
Yeah, for me, of course, I'm not too sure about my career path yet. I mean, of course, I'm keeping my options open, but really doing this project has really opened like my eyes to like, this like the scene of like dementia as a whole in Singapore. And like even if it doesn't like become my job, like somewhat related to the healthcare sector, I think I could definitely continue to volunteer my time for this social cause. Yeah.
Thank you, Reyes. So of course the last but not the least, Isaac.
Yeah, for me, even though I'm like doing triple science now and whatever, but I'm not really looking into being a doctor. But I guess one of the reasons that I did this project is because like I really want to help people in my life, and I guess that's also related to my future career. Which I currently I'm still looking at being a teacher. So like for me personally, like a lot of teachers have been very important in my life. So that's the way that my career is looking at. So not doctor, but at least still helping people. Yeah.
Thank you.
That is the most important thing, because at the end of the day, you don't need to be a doctor to help people. All you need to do is have the spirit like these guys, have the heart like these guys, just for an aim, and that is.
Thank you. So I wanted to tell you, Dr. Arvinder, that in your profession, we have 3 brilliant students who don't want to be doctors. So the market for doctors has been lower. But I think at this age, rather than playing and studying, I mean, of course they are, but they did spend a good significant amount of time in volunteering and trying to give back to the society. I think we need more students like Isaac, David, and Reyes to come aboard, and do more voluntary work, which is not only uh, it's a blissfulness for even for yourself, because you know that you are spending your time in the right amount of place in the place, at the same time the amount you spent is also well worth. So I think good job, guys. I'm going to go for another last two more questions for the boys before we call it off for the day. So we know that, in the common signs of symptoms, right? We talked about it. We talked about the 10 warning signs, and but we still don't understand about the public perception, right? When we talk about certain cases, like somebody is suffering from certain illnesses or whatever, even someone who's facing currently dyslexia, or even something to do with that kind of people tend to give judgment quickly. So I'm going to touch a little bit on the emotional part right now. Judgments. What is your takes on this, guys? What do you think that the public should do? Do you think the public should comment, or should just keep quiet if they do not know what the person is going through? Because that could actually hurt the caregivers, right? What is your take on this, Rias?
Yeah, actually, I think that's quite a good question. Like, the thing is, many people feel like, or many people rather, they don't have family members with dementia, and perhaps it's quite a distant thing to them, and they don't feel like they have a need to actually kind of understand what dementia is about. So personally, like a lot of people may think that if they see someone with dementia, it's best for them just to perhaps distance themselves from them, because they don't want to get themselves into, let's say, any trouble or anything troublesome. So for me, I would say that it's obviously, if you have the time and ability to help, it would be good if you could volunteer your time to helping these dementia patients. But of course, if you don't have this time and this luxury of time, I think it's also useful if you could donate in terms of money, or just being understanding and not stigmatizing again towards not having a stigmatic attitude towards these dementia patients, and understanding that as dementia patients, they also have feelings, and they are just like us. They need to be understood and be integrated into society. Yeah.
Thank you, Rias. How about you, David? What is your view on that, on judgments and comments from the public? Because probably it's not awareness. It's good that you guys come on board and to share with this, so that more people can able to understand. But but sometimes you do get judgments and comments that can't be stopped. But what is your take on that?
I feel like, I think a lot of the judgments again come from a place of ignorance, as with a lot of types of judgment. And I think we just need to learn how to empathize with them and realize the situation that they are in, and realize that that could be us as well in the future. And the way that we treat them could also be the way that people treat us, and we need to realize that we need to treat them nicely, and to treat them as proper human beings, not just people who forget things like goldfish or whatever. And we need to be kind to them and treat them nicely. Yeah.
All right, thank you, David. How about you, Isaac?
Yeah, I agree with what David and Reyes mentioned, that a lot of times like these people will just keep quiet, or just like just try and distance themselves from people with dementia. But I think that one thing that people could do to, I guess, sort of destigmatize dementia would be like to find out more about dementia and like what it is and what it isn't. Like it's not that they are like gone mentally. It's just that maybe they are like more forgetful than us. So I think that other than volunteering and like donating, they could also just find out more about dementia in order to be more accepting and to know how to react and know how to treat these people with dementia. Yeah.
Thank you, Isaac. So it was a great discussion within the Hwa Chong Institute of Students there. Thank you so much. Now, Doctor, so now we will come back to the topic itself, right? I mean, we have another 5 more minutes before we end. So the conclusion we can say, I mean, of course, there's no conclusion for diagnosis, but to keep oneself active, all right. Even though someone can go into a retirement, but that doesn't mean that you chill back and you don't do anything, because your lifestyle has been so active for the past donkey 50 years, right? So 50, 60 years, and then suddenly you stop everything. So the routine has been disturbed, your schedule has been disturbed, the way you operate, your energy system, everything has been disturbed. And I think that's probably one of the reasons, right? When you become too free and then not much of activities or not going out with friends and going through a certain kind of, even for a walk or daily activities. Do you think that this could be one of the reasons of many that causes dementia?
I think it's a chain cycle. Basically, when you retire, your physical activity goes down. You have a better or increased chance of getting things like diabetes and hypertension, which may further eventually lead to dementia. So I don't think I think it's like a chain reaction. And of course, with a deterioration of cognitive function, brain function, not doing things for memorizing, that sort of thing, that may actually lead to deterioration. And unfortunately, with some deteriorations of the brain, which I didn't touch on earlier, which I will just share really quickly, is some people get delirium, meaning they start seeing things, they start seeing shadows, they start seeing people who have died, they start seeing people who are not there, they start getting a bit of schizophrenic symptoms. Unfortunately, it's because of the deterioration of the brain. And unfortunately, a lot of people, when they see this happening, they tend to resort to traditional treatments, where they take them to shamans, they take them to traditional healers in order to heal them. But actually the real problem lies, it's an organic cause which is actually within the mind. So I think not only awareness is important, I think people's understanding of it is more important as well. And good guys like these three gentlemen who are sitting here, who's doing such a good job, has taught all of us that not every hero wears a cape and not every hero wears a lab coat. There are heroes who are doing work like them day in, day out, who actually are educating the public in general, which makes the life of a lot of people, especially doctors, much easier, because people know what they're dealing with. So yeah, I think there's a whole big issue to it. After retirement, a lot of other things, metabolic diseases kick in, mental health also takes a toll. So I suggest that you may actually get maybe a little bit of rest from work, but I think best is to still keep fit, active, and mentally active as well.
Thank you, Doctor, and thank you guys for David, Riaz, and Isaac for joining us at Kopi with Reds. It was a great 1 hour 15 minutes of talk session. Of course, we have many questions that came in. Probably we can take them after which, because as promised, we always want to be in time for 1 hour talk session. It was a real great experience having these boys from Hwa Chong Institute. The students shared their valuable input and experiences with us at Kopi Events. And Doctor, as usual, your valuable time on a Sunday. Probably you might have your lontong or your some tikka, chicken tikka or fish tikka. But you tend to join Kopi Events on this project with the Hwa Chong Institute students here. Thank you so much. Thank you guys. So we will keep in touch and we will stay connected, and then we'll meet again once more if there's an opportunity to do another exciting talk. So thank you, boys. Thank you, guys. I'll catch you
Thank you so much.
Yeah.
Yes, thank you for
Thank
the
you.
opportunity. Thank you. Have a good night.
Thank you, David. And thank you, Isaac. So, Doctor, we have come to the last part of the talk session. And as usual, we would like to summarize it. Of course, we have a lot of people, boys and friends that have said it's a great talk. Thank you, and so forth. All right. So, you see, even we have Japan actually said a great talk, guys. Watch your students are very well. Very well mentioned. Thank you to Dr. Arvinder as well for your expertise. Keep it well. So, Doctor, again, we come back to the same topic again, dementia. So what you mentioned, that to keep one very active, and also by keeping active itself, you can't also prevent dementia, but the possibilities of getting there can be later than earlier. Can we agree to that statement?
I think it's slowing the progression down basically. So if a person is supposed to get dementia within the next 10 years, with proper physical activities, watching their food, especially food with high calories and high sugar, can actually help that can help with the progress of this particular disease. So what we need to do is we need to make sure we keep active, watch what we eat, and at the same time keep our brain active. So I think there are a couple of modalities which is involved here.
And it's also quite not alarming. I mean, of course, definitely it's alarming, right? Even for people with diabetes, also there's chances of other related illnesses to come in. So I think we have come to a point where we are working very hard and less time for exercise and a lot of outward bound rather than inward bound. So we work like a machine, like a non-stop. And then at the end of our golden age, we're supposed to enjoy, but that's where we are putting all the time of what we earned in that, and then put our loved one as well into a situation of taking care of us, and they're going through emotions as well. So I think it's very important as a holistic.
Yes.
The body is the most expensive stuff. I mean, we can't even use expensive. It's there's no
Priceless.
price tag for it. There's no
Priceless.
price tag for it, and we have to keep it well running now and after, till the last breath that we take.
Yes, absolutely agree. So I think one thing which we missed out in the beginning of the talk is those people who tend to get diabetes at a very, 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 very early age has actually high incidence of getting all the other complications and dementia and all that in later stages. So I think keeping fit and healthy from day one is actually very, very useful. And I always tell all of my patients, it is never too late to start. You can always start, even if you think that you're not in good shape today, but start tomorrow, start somewhere. You are actually slowing down the progression of any disease. That is what we actually eventually want.
As usual, Doctor, thank you very much for your time, for
Most
joining
welcome.
us at Kopi Events and sharing your valuable experiences and expertise with our boys here from Hwa Chong Institute. And we'll meet again, definitely. There's another exciting talk that's coming up next week. Of course, doctors are on board and with a different topic, with a different approach, with a different possibility of solutions and the problems, the current situation, and possibility of solutions. That is where we are going to meet you next, Doctor.
Thank you. I'm always happy to be here.
Thank you so much, and I will catch you again offline. And till then, take care.
Thank you.
Pleasure.
Cheers.
See ya. So we come to the end of Kopi events. So we spent a very good almost 1 hour and 25 minutes of a great discussion on dementia, and we have great, very enthused students. Three of them, David, Reyes, and Isaac, who shared their valuable volunteering experiences with us at Kopi events. And as usual, Dr. Arvinder sharing his expertise on his weekly, or sometimes we have it like 3 times a week, or sometimes 2 times a week. He always chip in and put in his input with us at Kopi events. And as usual, as the viewers who are constantly supporting us and suggesting what kind of topics that we should bring up on the next Kopi events. And it's my great pleasure and blessings to have everyone at Kopi events. As usual, let's catch up again next week. Till then, take care of yourself. Drink lots of water and coffee if you love. All right. Till then, I catch you. This is Van signing off. See ya and ciao.